So, let's have the first question.
Good evening, Prime Minister. My name is David from Darlington. My question is very simple. Since the 2019 election, when the Conservative Party won an 80-seat majority, do you believe that the Conservative Party have delivered anything of real substance and value since then?
Perfect. David, well, great to hear from you. I was in Darlington earlier today, working out of the campus that I set up there when I was Chancellor, which is a great example, actually, of levelling up. And you're asking, what have we delivered over the past few years? You know, you don't have to look much further than Teesside, actually, to see what we're delivering for people. Now, that is an area that had been neglected by the Labour Party for decades. And if you look at what's happened over the last few years, we've got a great Conservative mayor in Ben Houchen, who's doing a fantastic job. We've taken advantage of Brexit to create a brand new free port in Teesside. And what's a free port? It's something that we couldn't properly do inside the European Union. Outside of it, we've created them. It attracts businesses with tax incentives, and businesses are investing in Teesside, creating jobs in the industries of the future. I put the Treasury campus in Darlington. Just think about that for a second. In Darlington, right? Forget about not being in London. Forget about putting it in the north. It's not in one of the big northern cities, not in Manchester, Leeds or Newcastle. It's in Darlington. Because it's places like Darlington that are now getting the focus from a Conservative government. You can see it in the infrastructure improvements that are happening. Darlington Station being upgraded. The high streets and town centres in Stockton and Thornaby. Not so far from here. Spennymoor. All of these places getting record amounts of investment. Blythe. New railway line. So look, those are the changes that are happening. That is the plan that is working. And what is it about? It's about spreading opportunity, because that's what I care about. It's about making sure that wherever you live in our country, you can grow up and know that your dreams can be realised. You don't have to move away from your home. And I was speaking to young people today at that Darlington campus who were telling me about that. All from the northeast, up from Newcastle, from York, from Durham, from Teesside, from North Yorkshire, all of them working at the heart of government in Darlington. All of them said to me, this is incredible, I never thought I'd be able to do this, I didn't want to move down to London. That's what this Conservative government has done for young people across the north, as well as all the improvements which make sure that people can have pride in the place that they call home. And pride does come down to simple things, like making sure your high street's clean and is safe, making sure the transport in your area works, that we can build youth clubs. That's what all that levelling up money is doing across the northeast. And actually today, it's just funny, you had the first question, I was in Darlington in that office today. Like, you can see it happening around you. That is the change that you can feel. Talk to anyone in Teesside and they will tell you. And that's what I want to keep delivering. And if I can win another election, I can make sure that we can keep delivering that change. All of you can have the peace of mind that your kids can have that brighter future. We can have a renewed sense of pride in our country, and that's what I'm fighting for.
OK,
right,
Prime Minister,
next?
Thank you very much indeed. OK, let's see who's got our next question.
Good evening, Prime Minister. I'm Alex from London and I'm a student. As you know, the NHS is a key priority to most voters, and you said recently that you didn't make as much progress as you wanted to last year. But how can you convince us today that this year we're going to see some real meaningful change in the NHS and we'll see waiting lists fall? Yeah, thank you.
So, look, why should you trust me on the NHS? Well, first and foremost, I come from an NHS family. My dad was a GP, my mum was a pharmacist. I actually grew up working in my mum's pharmacy, delivering medicines to people who couldn't come in. That was my world. That was my parents' world. Those were their patients. That was our community. And I saw firsthand the incredible impact that primary healthcare in particular has on people's lives, the dependency that they have on it. So it's really important to me that we support our NHS. Now, I don't need to tell you the damage that COVID has done to so many things in our country, but particularly it's caused backlogs in the NHS, right? And whoever was Prime Minister, whoever was standing here tonight, there would be backlogs in the NHS because of what happened. You all know that, you're fair-minded people, right? But what are we doing about it? Well, first of all, we're putting in record amounts of money. So more money than the NHS has ever had. Some of you reasonably might say, well, hang on, maybe we should stop focusing so much on the money we're putting in and actually focus on the reform as well. So we're doing that too. More doctors and more nurses, because no one has ever trained enough doctors and nurses for the long term. But I've done that. Now look, we're the best one in the world. I probably will not be around in the 14 years that it takes to train the consultant that we're now starting to invest in. but it's the right long-term thing to do for our country, which is why I've done it. So massive expansion in the number of doctors and nurses we're training here, first ever long-term workforce plan, so that in the future we're less reliant on people having to come from abroad. And we're doing lots of new things, right? I could bore you to death with all the innovations, elective surgical hubs, community diagnostic centres, so you don't have to go to the big hospital to get your elective surgery or your MRI or CT scan. All of these things speed things up. Discharge hubs in hospitals, connecting up social care with the hospital so people can get home back to their communities quickly, speeds up times in A&E and ambulances. Use of the independent sector. So all of you now, if you and your families get referred by your GP for elective treatment, you can go on your app or talk to your GP and choose where to have your treatment. And that choice, giving you the power to choose where you want to go, speeds things up, improves competition and quality, and that's also helping. But look, we haven't made enough progress in spite of all those things I've told you about, which is a lot. The NHS is doing more than it's ever done before. We haven't made enough of a dent in the waiting list. Now, we've practically eliminated the number of people waiting the longest, 2 years, 1.5 years. But overall, the waiting list has largely risen over the past year. The good news is, though, we saw that it started to fall because we didn't have strikes for a period at the end of last year. And that has been a real challenge, and I'll just be honest with you about that. But in November, first month where we had absolutely no strikes in the NHS, do you know what? The waiting list fell by 100,000. Biggest 1 month fall in the waiting list in well over a decade outside of COVID. So that gives me the confidence that our plans can work and will work. The industrial action is something we need to work through, and we're going to continue to have those conversations with the doctors, and I'm sure we can talk about that later. But if we stick to the plan, I'm confident that we can bring it down. We got a sense that that was possible at the end of last year without strikes. And because of all those things that I've told you about, I know that it will just get better over time if we can get the strikes behind us.
Okay, Prime Minister, thank you. Talking long-term plans, though, is difficult, isn't it, in all of this? It doesn't bring you immediate results, which is often a problem for politicians. We do need to think in the long term. OK, let's have our next question, please.
Hi, Rishi. It's Keith from Edinburgh. My question is about social care. Social care is chronically underfunded, and government has abdicated responsibility to local government, effectively making it a postcode lottery for many. Do you agree that it needs radical reform? And if so, what?
So, social care is something that is a particular challenge for councils. And you're right, if you talk to most local council leaders, they'll talk to you about the challenges in social care. I think you all know we've got an ageing population that puts pressure on. And that's why just the other week, we announced an extra £600 million for local government across the country. And it will mean that on average, this coming financial year, councils will have about 7.5% more money to invest in local services like social care than they did last year. So that gives you a sense of the scale. And of that extra money that we've put in, the bulk of it is ring-fenced specifically for social care, because that's where the challenge is. Now, I don't have an overnight fix to the challenges in social care. Of course I don't, right? But I do know that if we improve how social care works with hospitals, as I was talking about, it will make a difference, because that's where there isn't enough join-up. And that's why we're, as I said, working hard, and it won't happen overnight because the NHS is a big system and social care obviously is spread across the country, lots of individual local authorities. But bit by bit, we're joining those things up closer together, and that's how I think we will bring real improvements to bear. Because, of course, it's important, right? I believe in a country where if you work hard all your life, you should have dignity in retirement. And social care is part of that contract we have with our grandparents and those who have come before us. So it's important that we get it right. I can't promise you it's going to fix overnight, but I can tell you we've just put a lot of extra cash in to help councils with some of that pressure going into next year.